MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Hey, everybody. Good afternoon. Good afternoon. It is Monday at 1 o'clock, which means it's time for this week's MedsPLUS Medical Minute. And today we have a special topic that we want to talk about because the heart of MedsPLUS and the heart of our business and our service is serving our seniors. And so we're very happy to share with y'all that September is Healthy Aging Month. So happy Healthy Aging Month to everyone, all of our seniors. We love you and we love taking care of you. So because it's Healthy Aging Month, we want to remind you that getting older does not mean slowing down. Healthy aging is really about staying active, engaged, and independent. When we were coming through a lot of our training, we learned about aging in place, how a lot of seniors want to age at home, don't want to have to go to assisted living or nursing facilities. So today, Dr. Jennifer and I are going to share a few simple strategies, plus how MedsPLUS can help support you and your loved ones.
Absolutely. We come across a lot of seniors, and a lot of times we can see that a lot of people think that growing old means slowing down. But as you said before, it doesn't. It doesn't have to be. So one of the biggest factors in healthy aging is movement. And as we always say, movement is medicine. The CDC actually has a Move Your Way campaign that encourages older adults or our seasoned seniors to keep moving, even if it's just 10 minutes at a time. One of the things that I love about Birmingham and throughout the city, at our senior centers, libraries, even some of the health centers that service our older seniors, they have chair exercises. They have line dancing, even at Railroad Park. And they have many instructors throughout the city that go to the different facilities once or twice a week, and the services are free. So seniors in Birmingham, check out your library, check out your community center, get that schedule and commit to moving and being engaged in some type of exercise. That can also include walking, gardening, or doing work in your garden. And you want to be able to improve your muscle tone. So now that you have more balance, and this will reduce your fall risk. So strength training helps with everyday activities such as groceries, lifting, getting from a seated to a standing position, in and out of the tub in the bathroom. All of those things are very important, and movement helps with the balance and the strength.
That's very important, Jennifer. And so it's not just about exercise, though. Exercise is important. Movement is medicine. You want to keep your body strong and healthy as you age. But here's something that we don't talk about enough, and that is sleep. Sleep plays a huge role in aging gracefully. And we know, because I have parents, I have in-laws, that many of y'all stay up too late. And that means you wake up late in the morning, and that throws off your body's natural circadian rhythm. And I know this because my mother-in-law and my mom are always up talking 2-3 o'clock in the morning. Go to bed, get your full 6 to 8 hours of sleep, preferably on the 8 end, and then wake up at a regular time each morning. Why is that important? When the circadian rhythm is disrupted, it can lead to things like poor cellular recovery. And you've heard us talk about that during some of our genomic talks, where we talk about how important it is for you to get sleep so that your cells can recover. But not only cellular recovery, but weight gain. When you're up 2, 3 o'clock in the morning, what are you typically doing? Watching TV or doom scrolling, as my 7-year-old calls it, and snacking. You're eating. And a lot of times that will cause weight gain. You're like, well, I just eat regular meals during the day, but you don't realize that you've eaten a pack of crackers or chocolate all night, and that will cause weight gain. Also, if you have diabetes, that's going to increase your blood sugar and increase your A1C. So if you wonder why you're waking up in the morning and your fasting blood sugar is high, think about what you ate after dinner. And that a lot of times will explain it. So how can we help this? One thing you can do is, of course, go to bed at a regular time, get up at a regular time, but also when you get up, go outside, whether it's sitting on your porch, going for a walk around your block. You want to get that natural sunlight, that vitamin D that comes from the morning sun. This will help reset your body, reset your biological clock, improve your sleep, and give your cells the chance to repair.
Okay, disclaimer. We do not want to pick on the sweet mom and mother-in-law of Dr. Long, but it's common among a lot of seniors. So I'm glad that you use that example because we have to say it quite often.
Mm-hmm.
So another piece of healthy aging is connection. Too many times, I don't think people understand that human connection is so important and so vital to their overall health. We have some people that live alone, either they're widowed or their loved ones have moved away. And sometimes they shut themselves off because they don't want to meet new people, whatever the case may be. But it's very important to have that human connection as it relates to healthy aging. Staying socially engaged, it prevents loneliness. And we've said it many times, loneliness can lead to depression, and depression can lead to dementia. Social connection is important, whether it's just talking about your favorite television show, talking about the news of the day, just stating what your opinion is on something that's current or relevant. Different ways to stay socially engaged. Of course, if you in a social setting, whether you choose to attend church or if you just have a meetup at the mailbox with a neighbor or just a phone call. And I remember, and this was before COVID, and probably years ago as well too, but there was always the Sunday dinner. And that was that human connection, that coming together, having the soul food, if you will, but just having that connection, seeing loved ones, checking in on each other. Not all families are able to do that. So whether it's family or whether it's with friends, whether you go out to eat lunch or just having a conversation, make it a point to check in with someone you haven't spoken to in a while. That will make a huge improvement, not only for yourself, but for that person as well. It helps to protect your emotional health. Also, caregivers, supporting independence is important too. So making sure that you're supporting the person that you're caring for to have some independence, but also making sure that you're being supported as well. But small changes in the home, such as making things easier for the person aging in place to get to, that they don't have structures or objects in the way that could possibly cause a fall. So making sure that the home is structured for independence, that's a great way for caregivers to help support aging in place. One of the most important we like to talk about is for medication management. So with medication management, we're able to help support not only caregivers, but the person that's taking the medication. Even myself in everyday life, I often forget, did I take this? Did I do this? Where are my keys? Where are my glasses? So it goes a long way when you're able to help support those that take medications, particularly if they live by themselves or if they depend on a family member to come and organize their medications. So the next thing I want to talk about is one of the services that MedsPLUS Pharmacy helps with supporting healthy aging, and that is through our blister packaging. Nearly half of older adults don't take medications as prescribed, and that is often due to forgetfulness. The benefit of the blister pack is that it helps to organize the medication by date and by time. So this can improve taking medication on time by 20 to 30%. So this gives a peace of mind not only for the patient themselves, but also for the caregivers. Next, I would like to share an example of one of our patients that has a blister pack and recently had to have a heart procedure in the hospital. So we were scheduling the delivery and realized that the patient had been in the hospital. So the first thing we asked for, of course, is the discharge summary that has the new medications that have been added, or if something has been discontinued. So at that time, we were able to see that they had begun a medication for a blood thinner. And this was one of the blood thinners that has to be monitored frequently, particularly in the first 6 to 8 weeks of starting the therapy. So we had to make the decision not to put that medication in the blister pack, but to also make sure what we had in the blister pack is what the patient would continue to take. So we were able to have a quick consultation with the patient regarding when is their next appointment for their labs to be drawn. Also, what is going to be that regimen for a reminder to take the new medication, the blood thinner? And then thirdly, what that communication would look like as soon as they get those changes and how we would set that next delivery up to make sure that there are no gaps in therapy. We were also able to counsel them for the side effects to watch for by being on the blood thinner, what foods would affect it, and how to monitor for those types of side effects outside of the visits. So we were really happy we were able to intervene with one of our blister pack patients and make a partnering decision on how to manage her medication in this phase of being on the blood thinners.
Yeah, and I think that's a great example of the way that MedsPLUS is different from other pharmacies. Traditionally, other pharmacies are transactional. So you'll go in, your doctor will send the prescription, you'll go pick it up. Oftentimes, the pharmacist does check for drug interactions, duplicate therapies, but we've both worked in those other pharmacies, Dr. Jennifer, and we know oftentimes that the level of the depth of care is not the same as you'd get at a pharmacy like MedsPLUS. So Dr. Jennifer shared a little bit about the blister pack, but a big component of what she just talked about was medication reconciliation. And that's particularly important after a hospital stay. So when you're discharged from the hospital, especially if you were in there for several days, you will probably leave with extra prescriptions, with new prescriptions. And they may be the same as what you had before, but oftentimes they are different because of formularies. If you're on a particular blood pressure medicine at home, the hospital may have a different medicine in that same class on their formulary. So they may temporarily change you to the new medication. When this happens, you often have old medications at the same time that you have the new prescriptions that you brought home from the hospital. And without a thorough review, this can lead to therapeutic duplications or taking the same medicine out of that class. It can lead to dangerous drug interactions where two drugs don't work well together, and just overall confusion about what to take. In fact, nearly 1 in 5 hospital discharges leads to a medication-related problem. So that's 20%. That's a lot of medication-related problems that may or may not be caught at your pharmacy unless they're doing medication reconciliation. So this is a service that we offer here at MedsPLUS to our patients. And we want to make sure not only are you on the most up-to-date medicine based on the therapeutic guidelines, but we also want to make sure that you're not taking 2 medications out of the same class. So this happens when you're discharged from the hospital, but it can also happen as you visit specialists. So as you have your primary care provider, they send you out maybe to a cardiologist for your heart, or an endocrinologist for your hormones and blood sugars. Sometimes this happens there as well. So we want to make sure that we reconcile your medications so that you're on the most up-to-date therapy. Before we go into our closing, we just want to ensure that you're aware of our events that are coming up. We always want y'all to know that we are out in the community. We spend a lot of time here in the pharmacy taking care of our patients, but we also spend time in the community making sure that y'all are healthy out there as well. So Dr. Jennifer, you're our fabulous diabetes educator. Tell them about our diabetes education and support classes coming up.
Absolutely. We would like to invite anyone who would like a refresher, who's been newly diagnosed, started on new medication, or just wants more information about how to manage, how to age healthy, how to live well with type 2 diabetes. It will be a series of 5 classes in a supportive environment. Everybody gets to know everyone. You're not alone. And we have fun. Not only do we have fun, we have incentives. We do your initial screening and then a post-screening, and then we do a graduation. So it is a fun time, a fun learning time. And we're currently holding those classes at the Salvation Army classroom in North Birmingham. On the flyer, as you can see, give us a call and we'll get you set up and registered today.
Absolutely. And we are still accepting new patients into this program. So definitely call in and get on that list. The next thing I want to talk about is something that's actually being sponsored by the American Diabetes Association. So on next Thursday from 6 to 7:30 at the Daniel Payne Center in the Birmingham Forestdale area, there's going to be a community conversation on eye health. One of the things, as Dr. Jennifer and I are both diabetes educators, we've learned that a lot of people aren't familiar with the special care that you should have with your eyes, especially when you have diabetes. So this is going to be a community conversation. We're inviting you out. I will put the link to register in the comment box so that if you're interested in learning more about diabetes and eye health, you can click that link and register for this community conversation. Last but not least, we are the vaccine queens, Dr. Jennifer. Tell them about getting their fall vaccines.
Wow, this is so important. And I know it can be confusing watching the news. There was talk about no COVID vaccine, talk about a prescription, no prescription. So as it stands right now, vaccines are available the way we've gotten them in the years past. At the very least, we need everyone to get their flu shot, the annual flu shot. Seniors, 65 and older, it's time for the updated COVID vaccine. We have those readily available. We will be posting where we are throughout the week, but you can always come to the pharmacy to get your COVID vaccine or flu shot. For our adults 50 and older, we're talking shingles vaccine, 2-dose series, as well as pneumonia with a chronic condition, and making sure you've had your Tdap shot within the last 10 years. So We give all ACIP recommended vaccines. We're just a phone call away. We'll be visiting senior centers, doctor's offices, churches, and health centers we've been at to administer those vaccines and educate the public.
Absolutely. So as y'all can see, we are very busy, but we thoroughly enjoy what we do serving you guys in the community. So this topic has been about healthy aging, but remember that healthy aging isn't just about living longer, but it's about living better, not just longer, but better. So if you or a loved one could benefit from our blister packing, our delivery, our medication review after a hospital stay, we'd love to help. Call or visit MedsPLUS Pharmacy and Wellness Center here in Birmingham. Our number is 205-650-4636, where your health and independence are always our priority. We want to thank you again for joining us this week. If you have any topics you'd like us to discuss in further MedsPLUS Medical Minutes, let us know. We're here to help. Hope y'all have a great day. Thanks and bye.
Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.